Hi, I'm Megan. I'm one of the second-year family medicine residents at Queen's. I'm actually based at the KTI site in Kingston and the Thousand Islands, but as you can see, I'm actually in Picton, Ontario right now, and this is one of the sites you can come to in second year for your community family medicine rotations. So I actually get to be here for 4 months. I'm doing some hospitalist, some emergency medicine, and some family medicine clinics, and it's great. Today, though, we're going to take you on a tour of the Kingston site. I hope you consider Queen's as, the next step in your career. So for the tour, what you're going to do is just use your mouse to click through the different rooms, as this is 360-degree format. And then you can also use your mobile phone and just move it around as you navigate through the experience. So again, thank you for coming, and I hope you enjoy your tour.
This is Haynes Hall, which is located in downtown Kingston, just minutes from Lake Ontario, City Hall, and historic Market Square. Haynes Hall is the primary site for teaching, learning, and the development of clinical skills. It's a modern 3-story facility which is home to the Department of Family Medicine. The Queen's Family Health Team, or QFIT, is also based at Haynes Hall. It's a busy medical practice which serves an extremely diverse population of more than 14,000 patients. Residents become part of an interdisciplinary team and spend much time here during their training. This is one of several procedure rooms at QFIT. Residents frequently return to the same clinics, patients, and preceptors, which maximizes the continuity of care. In their second year, learners become senior family medicine residents and have many opportunities for leadership, mentorship, and the teaching of junior learners. This is the Family Medicine building on Bagot Street, just across the street from Haynes Hall. Residents will also work here as there are 2 floors of clinic teams. The Center for Studies in Primary Care, the research arm of the Department of Family Medicine, is also located here. Both of the family medicine buildings are located in downtown Kingston, just minutes from City Hall and the waterfront. Kingston has a vibrant downtown with hundreds of shops, restaurants, theaters, and parks. A year-long calendar of annual events and activities makes it a great place to work and visit. We're now on the Queen's University campus, which is a short walk from downtown. Many of our residents will purchase a pass to the Athletics and Recreation Center, which includes workout facilities, gyms, squash and racquetball courts, and a large swimming pool. The Queen's Medical School building is home to the Clinical Simulation Center. Family medicine residents come here early in their first year to take part in what we call the Nightmares course, because it prepares residents for their worst nightmare while on call. The Nightmares course builds the skills needed to manage acutely unwell patients. Here in the simulation control room, residents are observed as they practice resuscitating a simulated patient who has lost vital signs. Cases are relevant to family medicine and get progressively more complex throughout the year. In this simulated Code Blue, residents have started CPR on an unresponsive patient. The process not only builds clinical skills, but also teaches residents to manage their emotions. The intensity of the situation can be increased through the actions of high-fidelity mannequins, which are capable of having a pulse, talking, or making sounds in their chest. We're looking at the Pediatrics Unit in Kingston Health Sciences Center, or KHSC. Family medicine residents will experience a combination of outpatient care, inpatient wards, and the NICU if they stay in Kingston for this rotation. Residents can also complete pediatrics in Oshawa or Toronto. This is the orthopedic operating room at KHSC. Residents may complete an optional selective rotation in general surgery, orthopedic surgery, or plastic surgery in their first year, which helps develop surgical skills. Surgical rotations can also be completed in either Oshawa, Belleville, or Cornwall. We're now in the KHSC Emergency Department, which is open 24 hours a day, 365 days a year. Patients come here if they're seriously ill or have injuries. A rotation in emergency medicine is another requirement for family medicine and can be completed in Napanee, Cobourg, or here in Kingston. For residents who complete mandatory rotations outside of Kingston, accommodation is provided. This is one of the apartments available for residents working in Belleville, which is conveniently located across the street from Belleville General Hospital. That completes our tour of the Kingston-Thousand Islands site. I hope you've enjoyed seeing some of our facilities, and I'd like to wish you all the best as you consider your options for residency.